Hello, everyone. Thank you for attending the Unlearn Your Pain and Relearn You workshop that I have recently developed. It is an 11-week journey where we do just that. We unlearn your pain and relearn you. Oftentimes, when we go through something uncomfortable for a long period of time, we end up actually forgetting who we are. We end up sort of putting aside the activities we once enjoyed. We put the relationships aside. We put all those joys and interconnections aside, and something moves in, which is that uncomfortable, unpleasant sensation, which tends to sort of just take over our lives. And if you have the experience of chronic pain, I totally hear you. I have been there myself. I was a former chronic pain sufferer, and I know all too well how it can be a living hell and it can feel like a very lonely journey. But I'm here to offer you something. I'm here to offer you hope. I'm here to offer you not management, but a solution. And I hope that we can just sit down or maybe move together and walk together and learn how to unlearn our pain and relearn who you are. So I get a lot of requests for this information session, but like most people, our lives are busy. We just don't have time to sit down and listen, or let alone sit down and have it's so hard to pay attention to new information when you have the constant bombardment of uncomfortable sensations happening in your body. So, if you have to get up and you have to stretch, if you listen to this while you're walking or talking or laying down, that's okay. That is all cool. All I'm here to do is give you information, and I'm here to plant that seed of hope. So, my name is Jessica Simpson. I forgot to introduce myself. Jessica Simpson. I am a freedom from chronic pain coach and an osteopathic manual practitioner. I absolutely love the body. And more recently, because of my chronic pain experience, I've actually learned to love the mind as well. And noticed that in my 11-year practice in manual therapy, that I was missing something very critical, which was also addressing the mind behind the muscles. So, whether you believe it or not, we all have a mind behind the muscles. And it's time we start listening to the mind behind the muscles to figure out what is the genesis of the chronic pain. And oftentimes it's not from tissue damage or disease, which was often thought in old medicine and old research. Chronic pain is way more than that, and it's actually a good thing. So, we're going to dive a little bit into that today. Feel free to email me any questions. I'm happy to answer or address them along the way. So, with that started, I'm going to pull up my slideshow and get this party started. Okay, awesome. So, just pulling up my screen here so we can get out all the distractions in the slideshows, and we'll get the ball rolling. And while that sort of sets up, we'll just take a moment to just take a deep breath in, maybe shrug the shoulders, maybe wiggle the fingers, wiggle the toes, maybe take a nice stretch. Maybe just sort of wiggling your body, just arriving in the moment. And here we are. So, welcome to this information session on Learn Your Pain and Relearn You. Again, because when we have been in pain for such a long time, or have had anxiety for such a long time, or fatigue, or any other chronic symptom, we forget who we are. We forget what our joys are. We forget who we are in our relationships. It's like our identity becomes the chronic symptoms, and we end up forgetting all the joys of life. So, what our aim to do in this workshop is to actually sort of reverse that pattern, sort of put those chronic symptoms aside and have you step into your life. So what you will notice is, how did I get here? So as I mentioned earlier in my journey, I was a former chronic pain sufferer. I suffered from horrible pain, was diagnosed with stage 4 endometriosis, which basically in layman's terms and medical terms just ends up being a bunch of scar tissue and all sorts of abnormalities that they call it in the pelvis that can lead to infertility and all sorts of pain. I was also diagnosed with a general anxiety disorder. I also had chronic ringing in my ears. At one point, I had chronic itching. I had chronic fatigue at one point. I had a bout of depression. I had all sorts of weird symptoms with my body over the past lifetime, I should say. And nor did I realize that any of that was interconnected. And there was one thing to say it was responsible. So if you look at the diagram here, you will notice my picture. I have a brain, and these are supposed to be lightning bolts, and my brain is sort of lit up like a Christmas tree. And the reason I've done that is because there's only one thing ever responsible for all of those things that I talked about: itching, ringing in the ears, anxiety, pain, fatigue, and depression, all sorts of things. These have been linked to the brain being the culprit behind a lot of these things. So it doesn't matter what label you have, it doesn't matter what chronicity you have. A lot of the time, the brain is responsible. And when the brain is responsible, it sort of lights up like a Christmas tree, and we start getting guacamole in our body and all sorts of symptoms. So you also notice on the left or right hand side of the screen, I had my training and my therapy done through Alan Gordon and Dr. Howard Schubiner. These people saved my life. They provided a therapy known as Pain Reprocessing Therapy, which led me to them with my chronic pain suffering. And thank God, because it literally saved my life. It is a mind body approach that is scientifically proven to retrain your brain pathways and how your brain interprets sensations in your body. And with this mind body approach, I was completely better, even though I had all these labels and I had all these different symptoms going on. It wasn't a symptom based therapy, which a lot of our models these days tend to be symptom based, looking at the body in isolation. But we can't do that when we're treating something chronic, because not only does it affect our body, we feel the pain and it's real and it's physical, but it also affects the way we think, our thoughts, our feelings, our beliefs. It also affects our spirit and our energy. So we can't treat something chronic and only look at it in one realm. We really need to treat anything chronic from a holistic approach if we wish to get better. So thanks to Alan Gordon, and thank you to Dr. Howard Schubiner. After they helped me in my own recovery, I had to know how to do this for other people. I had to know, how do I help the world? How do I get out there? How do I reach you? Because I thought that there was zero hope for me. I was labeled so many things. I was living in a constant state of fear and contraction. And once you come out on the other side, you just have this burst of passion that you just have to share it with the world. So this is my mission: to give you hope and to offer you a solution. So is all pain the same? What do you think? I mean, we all think that maybe pain is the same, but pain is not all the same. There's actually two different types of pain that I will address your attention to. So we have something called structural pain versus chronic pain. So structural pain, if we look on the left-hand side of the screen, is pain caused from tissue damage or disease. So if you were to come in and you were to have a broken bone or a laceration or some sort of injury or some sort of inflammatory process, we would maybe label that something as structural pain. Something in the structure of the body is causing the pain itself. versus chronic pain, which is pain caused by learned neural pathways in the brain. Yes, that's right. Pain caused by learned neural pathways in the brain, and oftentimes in the absence of tissue damage or disease. Well, what does that mean? That means that when pain is chronic, when pain is over like a 3 month period, about 85% of the time, which is a big chunk of the chronic pain world, it is actually caused by your brain learning the pain and learning the sensation. So you will see in this fMRI scan, the scan of the brain, you can see that the brain is actually lit up like a Christmas tree, kind of like my brain was lit up in the beginning of my chronic pain journey, too. So, no matter what, whether it's structural pain, where it's something you can see as damage, or chronic pain, sometimes you can't see it. It's very real, it lives in your brain, and you can have that pain in the absence of tissue damage. This is actually more common. So, no matter what, whether it's structural, whether it's chronic, it's all real. This does not mean this is in your head. This doesn't mean you're crazy. This doesn't mean you're broken. Your pain is real. And no matter whether you have structural based pain or you have pain that is based on learned neural pathways in the absence of tissue damage, it all involves the brain. All of it. You can't discount that fatty organ sitting at the top of your head. It is the master control. But not all pain is best treated in the same way, right? It doesn't make sense if you come into my office and you have structural pain. I can see physical damage, bleeding, lacerations, tumors, infections, all of that sort of thing. Well, clearly we need to work on the body for that sort of thing to sort of bring it back to harmony. Versus chronic pain, it doesn't really make sense for me to constantly only treat the body or the part of the body where the pain is being processed and forget about this fatty organ called the brain that's very opinionated at the top of the head because we don't really get anywhere. And this is why oftentimes when we have chronic pain, we either get a short term result from traditional treatments or sometimes we get worse or sometimes they do a scan of your body and they can't even find anything wrong, which can be extremely frustrating. We need to look outside of just the structural part of the body where the pain is being processed. We need to look at the brain. So the key to this is if you come and see me or you see a Freedom from Chronic Pain practitioner, we will perform an accurate diagnosis and assessment because we want to determine what your best course of treatment is. So if you come to see me, I want to know, are we dealing with something more structural? Let's look at your blood results. Let's look at your imaging. Let's look at your past medical history. And I'm also going to look at what's going on in your life, what kind of stresses you have. How do you feel about the pain? Are you frustrated by it? Do you have fear about it? Are you avoiding certain activities? These are sort of clues that the pain has moved more into a learned neural pathway. So we want to perform a really thorough assessment because we want to make sure what pain we're dealing with because structural pain needs to be treated differently than chronic pain does if you really want to get better. So pain reprocessing therapy is basically an umbrella of techniques that use mind body therapies to target those learned neural pathways in the brain. So, believe it or not, this is really great news because you can actually re-alter the structure and the function of your brain with mind body techniques, which means old science used to say if you had something chronic, that meant a lifetime. You just had to get used to it, you had to manage it. But no, new science takes a long time to trickle into the system. And it's actually on your side because it tells you that with mind body techniques like pain reprocessing therapy, you can change your brain. both the structure and the function, which has been scientifically proven in a recent study that I will bring to your attention. And the study is called the Boulder Back Pain Study. And they did this in 2021. And they wanted to test the efficacy of pain reprocessing therapy. How effective is this therapy? This is a groundbreaking study that changed lives, and I am one of them. It was so nice to see a study published to show for once that chronic pain was curable. There's not much out there that shows that chronic pain is curable. It's a very scary thing. So I will draw your attention. There was 3 groups in the study. We had a placebo spinal injection group that had 51 participants. Placebo, meaning these people all had chronic lower back pain, and they wanted to test if pain reprocessing therapy was effective in versus usual care and versus spinal injections. So the pain reprocessing group had about 50 people. And the usual care is just stuff that we normally do to manage our chronic pain. The placebo spinal injection, I'll just kind of highlight for a moment, was very interesting because the patients that had the placebo actually knew that they were getting fake spinal injections, like, those pain injections that a lot of us get into our body. They knew it was fake. But what I will draw your attention to is that people still got better on that. So the placebo spinal injection group, out of the 51 participants, had about 10 participants that got better just from thinking they were going to get better. The pain reprocessing group had 33 participants that were affected with the pain reprocessing therapy in a positive way. And the usual care was about 5 participants out of 50. So that means that 66% of the pain reprocessing patients at the end of the 4 weeks of the study were pain-free or nearly pain-free. In addition, a 1-year follow-up study was performed, and the pain reprocessing patients maintained the results after a 1-year study. Whew. Wait a second. Hold on. There's 2 things I want to point your attention to. They had to develop a new pain scale because research has never really had chronic pain come down so low in a study that they actually had to revamp the pain scale to be pain-free or nearly pain-free. That's just not heard of in research studies. And the second thing is people continued to get better and maintain the result after 1 year after the treatment. That is huge, people. That is huge. That means that it's not going to just last a day or 2 or a week or a month. Think about how much time, money, and energy and empowering that can be for you. Wow. And then 20% of the placebo spinal injection people got better and about 10% for usual care. So if you were to just look at the numbers for a moment, where do you want to put your stakes? This is what the evidence is showing. This is what science is showing. It's telling you what works, but yet we still end up down the rabbit hole of spinal injections or surgeries or medications. And I'm not bashing those things, but those things are not really scientifically supported in research to be a helpful thing for chronic pain. And why? We go back because chronic pain lives on a mental, emotional level, a spiritual level, and a physical level, like the brain. So what does this mean for you? It means that chronic pain has been proven to be reversible. Because research has shown that when you get a chronic pain diagnosis, it's almost the equivalent of a cancer diagnosis. It affects your psychology the same way when you're given that label. And now this means for you that your pain can be reversed. Wow, that is amazing. They also found in the studies that factors like fear, and you have a lot of fear wrapped up with the sensations, when you're focusing on the sensations and monitoring it in the background, when you get frustrated by it, when you try so hard to fix it all the time and you fight the sensations, this is actually what keeps the chronic pain in loop because you keep firing those learned neural pathways. And this is oftentimes why chronic pain, gets worse over time. It gets more widespread. You get way more symptoms. Maybe that go all of a sudden to the digestive tract, or all of a sudden you get chronic migraines or all sorts of weird things in the body. It's because you're becoming really skilled. Your brain is becoming an excellent learner of pain and all sorts of things. So it's becoming more and more sensitive to sensations. So factors like fear and those other responses I had mentioned, avoidance, when we start having fear of doing certain activities. I remember when I had chronic back pain, I first felt the pain when I was doing a squat. I used to do like high intensity training, and I was so scared that, oh my God, if I was tipped forward, I was going to herniate a disc. And it ended up creating real pain for me. And I started to like avoid, and I started to have like muscle guarding around that activity. So every time I would do a squat, I would get pain. Every time I would bend forward, I would get pain. Every time I would sit down in certain chairs, a hard chair versus a soft chair, it would hurt. Sometimes it wouldn't hurt, but sitting is sitting. So I started to avoid a lot of activities, and I started to have a lot of beliefs, maybe like you do, that my pain is due to structural tissue damage, disease, all of these things. And the problem with that is when we believe that our pain is based in our structure, when we're believing that our pain means that we're creating damage in the body and our activities are creating damage in the body, that actually keeps chronic pain more alive. So our beliefs, our responses, and what we avoid have a lot to do with how and why and when we get better. And this is what we train you in with pain reprocessing therapy. So what we do is we work on, again, changing your beliefs about the pain. I'm not here to sell you an idea. I'm trying not to seem too salesy here. It's more just my passion coming through. But we work on changing your beliefs because, like I said, the vast majority of chronic pain, and there is exceptions, about 85% of cases of chronic pain are shown to be caused by learned neural pathways in the brain. So what we do is we show you what evidence there is. What is the neuro or the brain science evidence behind this sort of pain? And what we do is we help you to believe, we help you to know based on evidence that chronic pain is more caused from non-dangerous brain activity. It is the brain perceiving sensations in the body as dangerous because of the belief that it thinks those areas are damaged or diseased. But really, it's your brain being opinionated, and based on your fear, it keeps revving up the pain. So really, it's non-dangerous brain activity rather than from tissue damage or disease. And as you start to learn that, as we start to work together on that, this reduces the fear, the cluster of fear, like the lightning bolts coming out of your brain, I like to say. It helps to reduce that fear because you know, oh, wait a minute. You mean I can squat, I can bend forward, I can sit, I can twist, I can take a deep breath. These things are actually not damaging me like I once thought they were. It's more my brain thinking that that's damaging me, which means I can actually do the things I love. Whew. That's empowerment. That's how we reduce the fear circuitry in the brain. So I just want to ask you some questions for a moment. Maybe close your eyes. Maybe get out a piece of paper. Let's see kind of where you're at. Have medical treatments been ineffective or just given you temporary relief for your pain? I know they were for me. They actually had a whole host of side effects. I've had like brain fog. I didn't feel like myself. And oftentimes, I was just getting very short windows of relief and sometimes even more flared up. Does that fit where you're at? Did the pain come on during a stressful time in your life? A lot of people come into my office. I've been doing this for 11 years now. And a lot of people come into my office and they have pain in their knee or they have pain in their back or their head or wherever in their body. And they say, it doesn't really make sense. I just started to get this pain. I just woke up with it one day. Maybe it was because I went to the gym like 2 days ago. Maybe I did something then. But I just want you to just, for a moment, expand what we've learned, be open, and think about, did the pain for you actually come on with a specific injury? Because that can happen sometimes. Or did it come on during a stressful time in your life? I'll share a little story with you. So I developed chronic lower back pain. I had no back pain before this time. It was in 2018. Life was good. I'd had all of my different gym training, all those things. And then I lost both of my parents in a 1 year period. And it was shattering for me. And on the night of my graduation from osteopathy school, I got really sad and my back started to hurt. And it was after that that it started to become chronic. But I don't remember doing anything specific. So pain is a danger signal in the body. A danger signal in the body. Meaning that if there is a mental, emotional, or spiritual threat, or something that just feels very overwhelming for your brain and nervous system to interpret, this can cause very real pain. And it did for me. I had no idea that emotional, mental, and spiritual factors could affect the way my body was expressing pain. I had no idea. I may have just been like you and think, oh my God, what did I do at the gym? Oh my God, did I bend the wrong way? I'm here to open your eyes. We're not just physical beings. We have emotions, we have thoughts, we have feelings. And when we have life altering things like that happen, it can create very real pain in your life. And not all the time right after. It can come on in time. Mine was 4 months after my parents passed. So I'm just inviting you to think. Did your pain come on during a stressful time in your life or around that time frame? Start seeing that. Do you have or have had symptoms in multiple parts of the body? Some days my body likes to play whack-a-mole, that game, and I will have a random toe pain or might have a bit of a tension headache one day, and then it'll all go away and I'll have a really good couple days, and then my back will hurt, and then I'll have anxiety. Like, what the heck? This more and more indicates when you have multiple pain syndromes or symptoms in the body on different systems, there's only one thing typically behind that, and that is your brain and nervous system being fired up and it's expressing through these chronic symptoms. So the more body parts you have sort of flared up all at one time, the better it is. It means you don't have a horrible disease. It means there's one thing behind it all, and that is your brain. And your brain can be changed, the structure and the function. which means these things can all calm down, not by treating your symptoms, but calming you down as a whole. Is your pain inconsistent of terms of where and when it appears and how severe it is? Oh my gosh. So funny. I had just this past couple weeks, I had a recent move to Perry Sound, by the way, from down south. And that was a very life altering thing for me. Everything in my life had changed. And I got very real pain that came back, but I wasn't afraid because I had this knowledge. I knew that this was big for my brain and nervous system. This was a very stimulating, changing thing, and my body perceives change as dangerous. So I had lower back pain, I had a knee pain, I had all these different things. Sometimes it would be there and sometimes it wouldn't. I would notice that my pain would be absent when I was playing a game or interconnecting with family and friends or at work. But if I was going to sit on the couch and all of a sudden I had time to focus on it, then it would be more severe. So is your pain inconsistent? I'm going to tell you, people, think of a broken bone, okay? You break a bone in your body, that's going to hurt all the time. If you have a cut in your back or your hip or your leg, that's going to hurt until it heals. It's not going to come, it's not going to go, it's not going to fluctuate based on your stress. And if your pain does that, that is a clue as well that your brain is behind the game. Do you think about the pain often or all the time? Does it worry you throughout the day? I know when I had chronic back pain, it was always there. Oh my God. If you think of like static on a radio, there's like sometimes the static was really loud, sometimes it was quiet. It was like there almost all the time, but it would fluctuate. And I would worry about it. I would think, oh my God, is the doctor's missing something? Am I doing something to continue to damage me? I'm having just a lot of fear about this. So if that's you, that's another clue that your brain is behind it, that there is fear behind it, which means your pain is workable. So this is all really good news. If you answered yes, if you could relate to any of those questions, then it is a clue based on an assessment when you come in as well in conjunction that your pain has moved more into a learned neural pathway problem. That you most likely have pain pathways in your brain that are there, that are real, creating very real pain and symptoms in your body. But the problem is not in your back or your knee or your armpit. The problem is your brain perceiving it as dangerous and as broken, creating the pain. And this is known as neuroplastic pain. So if you want the fancy name for it, neuroplastic, neural circuit, central sensitization is another name. All of these things, these are very, very real, by the way, and they're extremely common. Like I said, research has confirmed that the vast majority of chronic pain, about 85%, research by Dr. Howard Schubiner, one of the leading chronic pain experts, they persist because of these pain pathways in the brain. And a lot of people ask me, well, what sort of chronic pain? Because chronic pain is such a big umbrella. This could be chronic pelvic pain. This could be migraine headaches. This can be fibromyalgia. This could be repetitive strain injury. This can be anxiety. This could be so many things. It really is all the same thing. It just has different masks. About 85% are based in the brain, and probably only 5% of them are treated with a brain approach. Neuroplastic pain is more common than structurally caused pain. Did you know that? Why aren't we looking at it like this? Why are we treating neuroplastic pain from a purely physical approach? Why are we forgetting the mental, emotional, spiritual components behind that sensation? Especially when it's more common. But how much more common? In the Boulder back pain study, that study that I drew your attention to earlier, out of the 151 subjects that entered the study, 0% of the subjects entering into the study had chronic back pain that was structurally caused. What? Well, you may be thinking, well, of course, that the study wanted to test pain reprocessing therapy. So it's only going to focus on all pain being from a neuroplastic brain perspective. But no, the doctor that did it was looking at imaging, was looking at blood. He wanted to make sure that the subjects that entered the study had neuroplastic pain, not structurally caused pain. 0% out of 151 subjects. But you may think, but I was told that my spine has abnormal findings on my x-ray or MRI that are causing my pain. Do you know about the average person has about 3 to 4 abnormalities in their spine at any given time? So take a look at the study. Prevalence of degenerative spine imaging findings in asymptomatic patients, 3,300. I'll convert this for you. They had patients, 3,300 of them, who had no back pain. They wanted to see what their spines look like, essentially. So I'll draw your attention to the chart. From the age of about 20 to about 80, they scanned for disc degeneration. So depending on where you are in there, so I'll give my age away, I suppose, in between 30 and 40, about 68% of the 3,300 people had disc degeneration. About 40 to 50% of us have disc bulges. About 31 to 33% have herniations. Herniations, that's where the discs in the spine, that jelly-like thing, sort of pops out. Okay? What does this study show us? Remember, these patients did not have back pain, and they have all these abnormalities in their spine. This goes to show you, and there's many studies behind this, that things like disc degeneration, disc bulges, herniations, slip disc, all of these things that we think cause pain really don't. The science is very clear on this. It doesn't make any sense. You would expect these patients to have perfect looking spines like we think in our brains. And I'm going to tell you that all of these things, degeneration, disc bulges, herniations, these are normal abnormalities. These are normal abnormalities that do not cause pain. They actually don't know, and this is from Dr. David Hanscom, who is a world-renowned spinal surgeon. They actually don't know where lower back pain comes from, but now they're starting to see that it's brain and nervous system driven. I'll tell you, I used to have chronic back pain. I was shown that I had a herniation in my L5-S1. I went through pain reprocessing therapy, started with pain. I now have no more chronic pain in my back, except when my brain is all fired up from life events. But guess what? The herniation's still there. So what changed? My brain and my nervous system. We started to calm down the fear. We started to calm down the focus. I started to learn who I was. I started to get back into my activities. I started to feel joy in my life. I started to have knowledge that my mental, emotional, and spiritual components were all playing a role in how my brain was perceiving my body. We never want to assume your pain is neuroplastic without sufficient evidence. So I think right now what we need to do is we need to have some fun. Let's kind of just see for a moment if your pain maybe have a neuroplastic brain component. Let's just have some fun. So I'm going to invite you to sort of just close your eyes, whether you're sitting, standing, walking. If you're walking, maybe sit down so you don't crash into something, create tissue damage. And I want you to sort of tune into a part of your body that is kind of calling your attention with pain sensations. So I want you to just call into it. I want you to breathe into it. I know you've probably already been focusing on it on and off throughout this conversation that we're having, but I'm going to invite you to sort of notice the sensation. Sort of start to watch the sensation. Start to breathe into the sensation. See if you can sort of breathe in and expand the energy around the sensation in the body. Now, with everything that we have learned right here, right now, knowing that you are most likely in this chronic pain case, I want you to, for a moment, be open. I want you to, for a moment, just forget everything you think you know about what's going on in your body. Forget about the labels, forget about your diagnosis. I want you to forget about it. And I want you to believe and learn that, oh my God, my brain is probably behind a lot of this, which means I am safe. So I want you to, for a moment, just notice what your thoughts are. What is your resistance to that? Ask the fear or the resistance if it's willing to step aside. Know that you're not trying to get rid of the fear or the resistance, you're just asking it to step aside. Notice if you have space in your mind and body that was created from that. And putting it all aside, I want you to look at that part of your body, take a breath into it, and repeat after me out loud, like you own it. I'm going to do this alongside with you. I'm going to do this for my back today, my lower back. So I'm going to take a deep breath. I would invite you to repeat after me, repeating these words like you actually freaking mean it. Like it's your job to let me know your truth, that you're okay. So taking a deep breath. I am healthy. I am freaking strong. There is absolutely nothing wrong with me. There's nothing wrong with this part of my body. I can do what I want. I can take a deep breath how I want. I can move how I want. I'm in charge. I know that my pain that I'm feeling, that is very real, that is caused from my brain. And because of this, I know I can get better. Because there's nothing damaged or diseased or broken about me. I'm in charge. I am powerful. I am safe. I'm going to step into my joy. I'm going to own my life. I am safe in my mind, in my body. I am safe. So as you repeat, I am safe into yourself, I want you to imagine that you're showering those safety, powerful messages into the body because it's impossible to feel afraid and empowered at the same time. Knowing that you're already calming down those brain pathways in your brain, you're already reversing them because you're a rock star. So just keep showering in those messages of safety, of warmth and security. Smile to yourself, love who you are, take a breath into who you are. And when you're ready, you can wiggle your fingers, wiggle your toes. You can repeat that as often as you like. But I want you to tune into that sensation that we first started with. Just notice if there's a difference. Just notice if there's a shift in your energy. Maybe notice if there's less fear. Maybe notice if you have more confidence and empowerment and you want to step into your life. Notice that the sensation may still be there, maybe less, maybe more, but it doesn't matter because we're changing our relationship to the pain. We are having fun. We are responding differently. Let's take the advice of Robert Frost and take the road less traveled with our pain. Instead of scaring yourself, instead of following the labels, instead of only looking at your pain through tissue damage or disease or whatever symptom you have, freaking put it aside and try something new. Be powerful. You're safe. You're okay. We're in this together. So that was our assessment. That's part of the assessment that I will have with you when you come into my office or virtually. We're going to do these sort of things. We're sort of going to shake up the way you perceive your body. And we're going to have fun doing it. We're going to actually heal with fun and joy. Those are the energies that bring you back to love, that help you heal. So it's time to unlearn your pain and it's time to relearn you. That's what we can do together. I know it's scary. I know you maybe tried many things and didn't work out. You maybe spent a lot of money and you don't feel any more empowered at the end of the day. That's okay. I honor where you're at. It's okay to be afraid, but you can unlearn your pain. We just started to do that together. We started to already relearn who you are. You are that powerful, empowered person that I know you are. You are not your chronic symptoms. You are not your chronic pain. You are a powerful freaking person. So if I pull your attention to the diagram here and we look at the center of the diagram, you will notice a danger signal. Let's say that blue circle in the middle. That is your brain right now. And if we were to describe the process of how neuroplastic pain works, this is how it sort of works. We have many things that can make the brain feel unsafe and activate that danger signal. That could be everyday stress, like a tough boss or a hard relationship. Could be adverse childhood events. Research has shown that about 2/3 of individuals with chronic symptoms have had some sort of adverse childhood event. Could have been physical or sexual abuse. Just a hard childhood where we had to learn how to be perfect. You had to learn how to please other people. these sort of develop into chronic symptoms over time. Unprocessed emotions, it's huge. A lot of us don't feel safe. We don't know how to express what's inside. We don't know how to be emotionally sound. So we end up just suppressing our emotions, like fear, like anger, like sorrow. We suppress them because at some subconscious level, perhaps, we don't feel like those things are safe. So that could be causing your danger signal. Tissue injury, of course. We all have bumps, scrapes, bruises, whatever. We all get those through times. That can cause the danger signal to go off too. So what happens is when this danger signal is activated in your brain in the center, your brain starts to form a memory pathway of the sensation. Like I said, chronic pain often gets worse over time. The sensation gets worse over time because it just means you're a really good learner. So we end up developing this memory pathway in our brain, which again, remember, is very real. So we get symptoms. Our body has to express these suppressions, these everyday stresses somehow. So we end up with chronic pain. We can end up with anxiety. We can end up with gut issues, depression, fatigue, sleep issues, all sorts of things. Whatever symptom is going to get your attention, your brain will create whatever symptom. Like I said, I have a very long list of what I had in my body happening. So we get the symptoms, and basically we have certain responses to these symptoms. We often respond with fear. Oh my God, what is this thing? This is new. Is there something wrong with me? We start to worry about it. We start to focus and monitor it. We start to get frustrated. So we have all these responses, which are actually counterintuitive because they actually end up reactivating the danger signal in your brain at a subconscious level. You're not doing this on purpose. This is not your fault. This is not common knowledge, but it is our responses that keep the symptoms alive. How pain reprocessing therapy works is it breaks the relationship between your symptoms and your responses. So we are going to teach you new responses. Like I said, sometimes that are not second nature. It's not easy, but it's simple. So we're going to learn new responses. We're also going to learn stress managing tools. We're also going to learn how to process your emotions. A lot of the times, the emotions can lock up the skeletal framework of our bodies. Okay. This is good because we're not focused on your symptom. I don't really care what symptom you have. I mean, I care about you, but I don't care about what expressions are happening in your body because we can easily get stuck in the back or we can get stuck in the head. But that's not where the problem is. So the roadmap. So we're going to work together. We're going to do a diagnosis and a specific assessment to figure out, is your pain more structural based? Is your pain more have a learned neural pathway component, which you've just learned? Oftentimes we have a bit of both. So people will come and see me and they say, you know what? I've had a structural diagnosis. So for example, I had endometriosis, which is a very real tissue disease. It's also very common. So I have a lot of women come to see me and they say, well, I have this structural pain. Could this still help me? Well, I have Parkinson's. Well, I have an inflammatory arthritide. Whatever. I know this can help you because you can always learn better responses. to what's happening in your body. You can always learn how to have your mind be a friend to your body. You can always learn how to process your emotions. You can always learn how to manage everyday stress. You can always learn how to start stepping back into your activity, no matter what pain, structural or neuroplastic pain. I mean, I have endometriosis. I mean, I don't hate saying that because I don't feel like I do anymore. But I went into this with an open heart and an open mind because I was friggin' ready. And I'm okay. I still have the diagnosis, but I'm okay. I had no idea that like 98% of the pain that I was having was based on my brain firing these pain pathways. And I still have doctors look at my pelvic ultrasounds and go, my God, you're the worst case scenario I've ever seen. Literally, I had a surgeon come up to me after my surgeries and tell me I was the worst case scenario he has ever seen in the pelvis. And he doesn't understand how I was functioning so well. Well, that's because they didn't do surgery on my brain. They don't know, they can't fMRI or MRI fear or x ray fear in the brain. They didn't know that fear for me was really the fuel for the symptoms. Now, I don't know what that will look like for you. There's only one way to find out. So, we're going to do an assessment. We're going to have some education because did you know that even by you sitting here, walking here, laying here, and learning this material, that you're already starting to reduce those pain, fear, neural pathways in the brain. So you may already start to feel better just by learning about the science of this stuff. Then we're going to learn some pain reprocessing techniques. Remember, I said there's a variety of mind-body techniques. Learning different responses, learning how to manage everyday stress, learning how to process your emotions, maybe finding out what is the pain's message. Oftentimes, pain actually has a message for you. It's knocking on you through the door of symptoms because it wants you to know something. It's trying to point your attention to something that it doesn't feel safe in. So, what is your pain's message? That may kind of happen along the way as well. And transformation. As we do these things, we practice these things, we build those new brain neural pathways, we have fun with it. We play, we have patience with ourselves, we're persistent, we practice even if we have a flare up of a day, or we're having a good day, or we're having a mediocre day. We're just going to practice together. We're going to play around. We're going to have patience. And at the end of it, empowerment. Ultimately, I want you to get to a place where you feel empowered. There is nothing worse than handing over your healing to someone else. There's nothing worse. I hated it. I hated having to go to a practitioner every month. I hated having to rely on a medication, a surgery, a label, an exercise. That wasn't empowering for me. It just told me more and more that my body was somehow broken and my body was somehow causing the pain and the activities I once enjoyed were causing my pain. That's not empowerment. You're going to do the work. I'm going to work alongside you. And as you learn the work, you're going to get better because you do the work. That's right. You're going to own your success. You do the work, you own your success. That is empowerment. It is empowerment to know that you don't have to go to anybody else unless you really want to, of course, because you have to be fixed. You will learn tools that you can use with yourself 24/7. This is a life course. This is not even like a pain management course. This is a life course. So over the next 11 weeks, typically we book once a week or every 2 weeks. We hold them virtually. So I'm able to work with people all over the world, one-on-one. Sessions are between 60 and 90 minutes. We learn a lot of things. We practice a lot of things. And yes, you can unlearn your pain in the comfort of your home in your pajamas. Kind of like that idea. I mean, COVID kind of got us used to being at home and kind of being cozy, right? So you can still unlearn your pain in your pajamas. We're going to learn about the pain fear cycle and how the specific role of fear plays in the chronic pain and symptoms. We're going to learn emotional processing techniques and how emotions play a very real role in chronic symptom formation. And we're going to learn some really powerful expressive tools. We're going to learn something called the internal family system. Yes, you have a family system in your body. We're going to learn how to work with your inner child so we can connect with your inner joy. We're going to learn some pain reprocessing techniques, those mind body scientifically proven techniques to get you out of chronic pain. Pain neuroscience, I call it the curious lens, and some other brain retraining activities. We're going to learn about the 6 F's of pain that keep you stuck. Yes, oftentimes we F our own healing up because we stay stuck in the F's. And it's a hint, your key to recovery is based largely on how you respond to your pain. So that's where your power is. We're going to learn the C's of healing. We're going to learn your customized graded exposure plan to get you living back in the life of your joy. So there is actually a way that you can get back into your activities again, and it doesn't involve me pushing you off the diving board. So when I was going through this program, I had like a death fear of going underwater, and I held that fear for like 20 to 25 years. I can't even remember how long now. It was like a lifetime. You just ask my family and my friends. I could not go underwater. I couldn't get my ears wet. I felt terrible every time I got invited to a pool party. With this pain reprocessing therapy, I learned how to unlearn my fear as well, because fear is a big part. And now I'm like a fish in the water. So we come up with a plan specific to you to find out where we need to get you back into your life. We look into the science and application of joy, play, gratitude, and yes, freaking celebrating yourself. We forget to celebrate ourselves. You may forget to celebrate the fact that you listened to this almost whole recording, learning about what pain is and how all these different things could be involved. That deserves an ice cream. We need to celebrate that. We're going to learn about self-compassion, how to use self-compassion to build internal love and safety in the mind and body. We're going to look into the role of people-pleasing, perfectionism, and all of these things, the inner critic, and how these things actually keep you in the chronic symptom world as well. Yes, that's right. It's a big one. Perfectionism and people-pleasing. Feeling overly responsible for other people's well-being. Those are all things we need to learn how to manage. We're going to learn the 1, 2, 3, 4 stretching of the mind and body, which was created by Paul Chek, integrated in his scientific stretching course. I've integrated it in a mind-body way. And we're going to look at how to use the body to calm the mind in this way. We're going to do vision boards. Yeah, that's right. The pen, the paper, the markers, the glue, the quotes, the pictures. We're going to get that. We're going to get you what you want to be on the board. We're going to have some fun with that. We're going to look at the energy systems and how it relates to chronic pain development and recovery. Yes, you have a body. Yes, you have a mind. And yes, you have energy. Your body is energy. It's not woo-ha. You are actually made of energy. Energy cannot be destroyed or transformed. Sorry, your energy can not be destroyed, only transformed. So we're going to look at how your energy systems play a role in the chronic symptom recovery. We're going to learn about food and flexibility. And we're going to have fun with this. We're going to look at different tools to help support our water, the food we put into ourselves, our fuel. That does affect the mind, that will affect chronic symptoms. We're going to learn how to integrate. I mean, That's a big thing that's missing in a lot of courses and a lot of great books that I've read is, well, how the heck do you integrate this? What does this look like for my healing? What am I going to do if things flare up for me? What am I going to do if I have a setback or I'm having a really good day? How do I handle the ups and downs of life? And how do I use these tools in those applications? So, we're going to look at how to integrate so you can live these tools. I'm also going to provide for you weekly guided meditations that pertain to the topic and sort of just calm and empower you through the process. So one-on-one coaching investment program cost is 18.15 Canadian for all 11 sessions. Some people go that route. I also do a payment plan of 665 Canadian in 3 payments, which we can do at week 1, 5, and 10. So we can break it up for you. That can be a lot. We're going to you can pay as you go along. Some people are more comfortable with that sort of thing, just paying as they go along. Again, you're going to get all the materials we talked about, your weekly guided meditations, recordings. You can actually like hear how you change over time. It's pretty cool. And one-on-one support. And we're also going to link you with the Curable community. Curable is a fantastic app. It was my foundation for healing, and it is a pain reprocessing therapy app that teaches you some of these mind-body tools that you can use on your healing path. So I'm going to offer you a 6-week Curable membership. It's a fantastic support. And also a copy of my new co-authored book called The Magic of New Beginnings, where I sort of tap into a mind-body perspective in the face of change. So it's time for you to step into the role of being the CEO of your healing journey. Again, we talked about empowerment, saved long-term costs. I mean, I was spending, oh my God, like $700 plus a month just trying to maintain a short window of relief. I want to teach you how to live a courageous, adventurous life. I want to show you tools that you will use for the rest of your life in every area of your life. And research that actually supports this treatment approach. I don't know about you, but I want to know where the research lies. I want to know what the research shows work because I want to put my coins into that basket to get better. And a coach like myself to keep you accountable along the way to support your growth. We all need somebody to sort of kick our butts softly. We all need somebody to just say, it's going to be okay. You're doing well, keeping us on track. So a coach is actually very, very important for that. So what does your chronic pain cost you? I mean, freedom to do what you want when you want to do it. You can't put a dollar sign on freedom of what you want to do and when you want to do it. Can't put a dollar sign on that. What about, do you miss time off of work? What about just missed presence in your everyday relationships? I know when I was having chronic pain, went out to dinner with my husband and I couldn't even focus on our conversation. I just kept focusing on the sensations in my back. I wasn't even paying attention. It like turned me into a narcissist. It like overconsumed me. So again, missed presence. A life of surviving, not thriving. You wake up to just do it all again, over and over again. Does your chronic pain cost you peace? Just being able to relax and be comfortable. What about your short-term relief costs? So I want to thank you for being with me through this information session. I know it was a lot of information, and I hope it was a lot of fun. And I hope the message of my heart reaches your heart. And I hope that you have the courage to say yes to you, to learn who you are, to step up to who you are, to know that there is hope for you. And there are thousands of people that have went through this process and they have gotten better. And I know you can too. And I love this quote by Camille Lewis. Taking care of yourself is a resilient act, one that requires vulnerability, rest, and compassion. We're going to be vulnerable. We're going to learn some dark, shadowy things about ourselves. But it's only when we bring light to those shadows that we understand the information of our chaos. That's how we transform. Rest. because we're going to be rusting some of our old beliefs that you're a damaged, broken person. We're going to rust some of those ideas and having compassion for yourself along the way. This is not easy. You have not had an easy life. As humans, we struggle. And it's time to just put your hand on your heart, take a deep breath, and just honor where you're at. Hold it, love it, breathe it, recognize it, radical acceptance. That is compassion. So thank you for, again, I'm going to shut off this screen here. There we go. So thank you for being here with me today, spending this time with me, learning, sharing. I don't bite, so you are welcome to email me with questions. I do perform free assessments, free information. This is what I'm doing. This is my mission. I would love to provide this all for free, but like you, I do have to make a living, but I don't want it to feel like work. My passion is to help you in the way that I was helped, and I hope I get to translate that out to the world. So if you want to learn more, you can email me, Jessica, Jessica, at mindfulnessinmotiontherapy.ca. Mindfulness, Mindfulness, in motion, INMOTION, therapy, THERAPY.ca. And I look forward to working with you. And I hope you have the courage. So just take a breath, shrug the shoulders, know that you are not alone, that you're going to be okay, and that you are here. Bye for now.